How should I be breathing while I'm working out is a question that I get really often. By the end of this video, I hope you'll have a better understanding of some of the ins and outs of breathing specific to strength training, as well as some overarching concepts about breathing in general. I will be doing a bunch more videos on breathing, more in-depth, kind of 101, 102, 103 levels of breathing awareness and how to learn a little bit more about how you should be breathing in some different breath practices. But in this video, we're going to cover specifically the do's and don'ts of breathing while you are in here using these machines. So when it comes to overarching breathing concepts that can be related to what you should be doing in here while working out, one of the sayings that I like and I say a lot, and you may have heard me say before, is you should breathe through your mouth about as often as you eat through your nose. Noses are for breathing, mouths are for eating. Exceptions being talking is a controlled exhale through your mouth. Obviously, you can't do that without breathing out through your mouth. And if you're in like super high output, sprinting type cardio workouts or 1 rep max type strength training situations, you may be required to breathe through your mouth in those situations, but that's like 2 or 3% of the equation. In every other situation, you should be breathing in through your nose and out through your nose. And while you can get away with breathing out through your mouth, it still is better if you breathe out through your nose, partially because you will get dehydrated less quickly if you breathe out through your nose. When you breathe out through your mouth, your body expels more water vapor through your saliva and everything like that, so you end up actually dehydrating more quickly. So you should be breathing through your nose basically all of the time that you're in here, unless you're doing some sort of a interval type workout where you're getting really high up there in terms of heart rate or something like that. But for the most part, almost every time you're in here working out, you should be breathing in through your nose and out through your nose. Now, there will be some exercises in particular where you may find it's difficult to actually breathe at all, and those machines will specifically be the machines that are involving core musculature. Now, the reason for that is when you breathe beyond just a little bit in and a little bit out, it changes what's called your rib cage volume. Your rib cage expands as you breathe in and contracts as you breathe out. And when you're engaging in an exercise that requires muscles that attach onto your rib cage, we want to try and do our best to make sure that our breathing pattern is not drastically changing the volume of your rib cage. So not breathing all the way in or all the way out, because those muscles need something firm to grasp on and to pull off of. So if we're trying to do a rotational exercise and while we're doing it, this is changing. These muscles don't have as stable of a base to yank on. So what you want to do is make sure you're using more of a breathing pattern that might look something like this. You're getting on a machine, you're doing the abdominal flexion exercise, for example. You should not hold your breath the entire time. If you get the weights up really high, you might have to hold your breath while you're moving the weight. But especially when you get to the end of the motion on the way forward in that example, or the end of the motion on the way backwards, is a good time to take a couple sips of air and then go again. But you're never going to go and then go in the movement, because that will change your ribcage volume. So you want to keep those little sips in and out of air pretty small, to the point where you can do those without noticing that your ribs get super expanded or super contracted, and that's about the depth that you should be breathing on any kind of a core exercise. If you breathe too deeply in and out when doing those, you're going to notice that your performance suffers on them. You won't be able to move as much weight. You won't be able to feel the contraction as well, because again, the thing that these muscles are pulling on is changing in its position, and in terms of the volume of your rib cage is changing, so these muscles are kind of trying to pull on something that's sort of wobbly. They're trying to pull this end towards this end, but this end over here is kind of wobbling as they're trying to pull this one, meaning they can't generate as much torque and as much force, which is a problem when we're trying to strength train. So taking those little sips of air in and out, especially at the ends of the motion, and if you do need to take a deep breath, just pause for a second. Get yourself back into a neutral ribcage volume and then continue with your set. That little pause is okay, but you do not want to hold your breath entirely. You want to make sure you breathe in through your nose and out through your nose, and you want to make sure, specifically on core type exercises, that your breathing pattern is such that it does not drastically or even noticeably change the volume of your ribcage, otherwise your performance will suffer. And there are some machines and some exercises in here where you may find you actually are stronger if you maximally inflate your ribcage. Things like a chest press or a row. When you have a larger volume of your rib cage, it gives your muscles a bigger lever to pull off of. If I have a larger rib cage, that means that my pec has a larger moment arm and more torque generating capacity than if my rib cage is collapsed down. So you may notice things like a shoulder press, a chest press, a row, a pull down, some of those upper body exercises, you actually can move more weight around and get better contractions in those muscle groups if you, before you start the exercise, get a nice full breath in, inflating through your diaphragm, trying to push your ribs out, and then keep that same volume while you're performing the movement. And then as you're doing the movement, because you still do need to breathe, you keep that maximal inflation with just little changes in sips of air in and out at the top of that rib cage volume while you perform the exercise, so you don't pass out while doing it, because that would also be a problem. But getting that maximal rib cage volume on things like shrugs or kind of some delt exercises or anything upper body really will actually give you, in most situations, a better mechanical advantage on the part of your muscles to move more weight around and to build more strength if you maximally inflate your rib cage. It's not required. You'll still build strength if you don't do that, but it's something to mess around with. Is before you get on the chest press one time, just kind of have a neutral or a deflated rib cage volume, see what it feels like to perform that movement, and then the next time you do a set, kind of compare it by doing a full diaphragm rib cage inhale and then do the movement, and you'll probably notice that the weight that you are using is not even nearly as challenging anymore, but at the same time you get better contractions in those muscle groups. So that's another thing to mess around with when it comes to breathing on some specific machines, specifically those upper body ones. So to recap all of that stuff in this how to breathe while you work out video, you want to make sure you breathe in through your nose and out through your nose. You can kind of get away with out through your mouth if you really, really enjoy it for some weird reason, but in general, in through the nose and out through the nose, unless you're in this super high output phase doing like a German body composition workout or some sort of interval training, then you might need to breathe through your mouth a little bit, but oftentimes the signal that you need to breathe through your mouth is a signal that you might be doing too much anyway, so you can kind of moderate how much you're doing to make sure you can still maintain nasal breathing. Then the other thing we talked about was making sure that you don't change your rib cage volume while you're on any kind of a core exercise in here. That would be the rotation, the abdominal flexion, some side bend stuff, some back extension things, just keeping your rib cage volume pretty consistent. Maximally inflated would often be best. And then on some of the upper body exercises, you can maximally inflate and then just breathe a little bit at the top, and that will give you more torque generating capacity and the ability to build a little bit more strength on some of those upper body exercises. So hopefully this helps kind of make it a little bit easier to understand how you should be breathing while you're working out.